Hi, my name is Dr. Julian Dooley. I work in PSI's Training and Education Division, and I'm going to talk with you today about social and emotional learning during COVID and the mental health implications of returning to school. So in terms of our learning objectives, what I want to cover with you today is really to increase our understanding of what social and emotional learning is and what kind of an effect a pandemic such as COVID-19 has on social and emotional learning, but also on students' mental health. So we're going to talk a little bit about strategies to build resilience as a way to mediate the effects of exposure to a pandemic. And also we're going to talk about some skills to promote social and emotional learning. And then the last thing that we're going to cover is I want to introduce you to our SAFE practices, which is really about taking care of yourself as an individual and an employee of PSI during our pandemic. So in terms of an outline, we're going to cover social and emotional learning, and as I mentioned earlier, some of the factors such as trauma, stress, and a global pandemic that impact on social and emotional learning. We're going to cover briefly some strategies to develop and build resiliency in our students, and some strategies to promote healthy social and emotional learning. And then, as I said, we're going to then discuss our SAFE practices. So the first thing I want to talk to you about is social and emotional learning. And just so we're all on the same page, social and emotional learning is really a broad concept that covers functioning in 5 different areas. And we're going to go through these individually. So the first one is self-awareness. And what that is an ability to really recognize your emotions and your thoughts, and to understand how emotions and thoughts influence your behavior. In the self-awareness area or strategy, we're really talking about the ability to assess strengths and limitations. So our Safe Schools program, for example, works with young kids. In our Safe Buddies program, we work with young kids and take a psychoeducational approach to teaching them the vocabulary to describe their emotions and to describe their thoughts, and to increase their understanding of how emotions and thoughts and behavior are all interlinked. The next area is self-management. And in this area, we're really talking about the ability to regulate thoughts, emotions, and behaviors. So this is sort of a step up from the self-awareness area, where you're taking that knowledge that you have and applying it to be able to manage and regulate those thoughts and those emotions and how they affect your behavior. In this area, we're talking about the ability to manage stress, to control impulses, and to really motivate yourself to be successful. The next area is responsible decision making. And in this area, we're really talking about the ability to make constructive and respectful choices about personal behavior, and really importantly, about social interactions. So this is starting to move into the social skills and social behavior, social functioning area, where our behaviors and our thoughts and our emotions are really having an effect and an influence in terms of how we relate with other people. And so when you start to kind of broaden out to a more social based skill, it really pulls in things like ethics, moral reasoning, safety concerns, realistic evaluation of the consequences of your actions. So these are fairly complex skills that we're relying on in this area of responsible decision making. The next one is sort of focused a little bit more on relationship skills, and what we're really talking about here is being able to establish and maintain healthy and rewarding relationships, not just with the people that are close to you, such as family members, but also with diverse individuals in groups. So you can see that this skill really relies on a great deal of capacity to be able to engage with other people who are different from you, to be able to communicate clearly, to listen actively, to cooperate, and to deal with constructive criticism in a positive and healthy way. And I think one of the very important things, and this forms a core part of our Safe Buddies program and our other Safe Schools programs, the Safe Skills and Safe Success programs, which is really around seeking and offering help when needed. Our next area is social awareness. This is the fifth one that we're going to talk about this morning. And social awareness is really the ability to take the perspective of and empathize with the people from diverse backgrounds and cultures. And again, this is kind of building heavily on the relationship skills area. In order to be socially aware and to be competent in this area, you really need to understand social and ethical norms for behaviors. So it's really taking those social standards and expectations and being able to internalize them and kind of keep them in mind when you're dealing with people from diverse backgrounds and diverse cultures. Okay, so now that we know what the core areas and components of social emotional learning are, let's look at some of the factors that might impact somebody's functioning or performance or capacity in SEL. For several decades now, we've been quite aware that what are called adverse childhood experiences, or ACEs, have a significant and detrimental short and long-term effect on not just social emotional learning, but also on mental health. And they really collapse into three broad areas of abuse, neglect, and household dysfunction. And what we see, and again, this is several decades of research supporting this, that what we see are among the short-term consequences are impairments in academic performance, impairments in social functioning, impairments in mental health, and also more long-term, we see a significant impact on physical health, so heart disease, cancer, liver disease. Kids who are exposed to ACEs often have difficulty with executive functioning. And what that is your ability to kind of manage your thoughts and manage your behavior. It's the skills that really determine success in schools. So your ability to engage, follow along in the classroom, to manage your time, to manage your assignments and your tasks, and also to manage your emotions. So kids who are exposed to ACEs often have poor impulse control. So that's the ability to stop yourself from doing something, and poor emotional regulation. So more broadly than ACEs, we need to talk about and think about the effect that exposure to trauma has on students' mental health and also academic performance. And the first thing I think is important is really to define what trauma is. So trauma is a series of events or set of circumstances that are experienced by an individual as physically or emotionally harmful or life-threatening, that has lasting adverse effect on their functioning in mental, physical, social, and emotional and spiritual well-being. So these are often kind of considered to be like acute situations. So situations of abuse or witnessing violence, either in the home or in the community. I think it's important to keep in mind, though, that we now take a bit of a broader perspective on what can be considered a traumatic experience. So things like abandonment or neglect or living in chronically chaotic environments can be considered to be traumatic, and certainly can have the same or very similar detrimental effects on mental health and social functioning and academic performance. One of the things that's important to keep in mind here too is that bullying is often considered to be a very traumatic event for lots of kids who are being victimized. So it's important to take a broader perspective and a broader focus on what we consider to be trauma, because in part, what is traumatic, and certainly in terms of the effect that it has on mental health, really depends on the nature of the experience, the characteristics of the child, and the way that the family, school, and the community respond. And you can obviously tell where I'm heading with this, that we are living currently in this global pandemic in a time that is significantly being experienced as traumatic by many, many people in our communities. So what kind of an effect does exposure to trauma have? Well, it kind of varies a little bit by age. So the typical response in elementary age kids are increased activity level, decreased attention or concentration, angry outbursts or aggression, a change in their ability to interpret or respond appropriately to social cues, changes in school performance. And I think, oftentimes these behaviors can look like a kid that's being disruptive, or a kid that's being disobedient, or not following along with classroom expectations. So I always say that it's very important to recognize that because a child is displaying a set of behaviors doesn't necessarily tell you what's going on in the background, where those behaviors are coming from. In middle school, you get a lot of the same types of behavioral responses. You also see a lot of irritability with friends, with teachers, absenteeism, increased somatic complaints, so tummy aches, headaches, chest pains, and that can be consistent with an anxiety response as well. When we start to move into high school aged, we start to see that these kids who are exposed to traumatic experiences are often at increased risk for substance abuse, absenteeism, again, a lot of angry outbursts, withdrawal from others or from activities, especially people that they might have previously been close to as well. And you start to see a lot of comorbidity with anxiety and depression, and again, with substance use as well. So I think these are behaviors and reactions and responses that we need to be very conscious of, especially as we're now transitioning kids back into the school environment. Although relatively speaking, outside of a global pandemic at least, relatively speaking, few kids would experience a traumatic event, relatively speaking. We see lots and lots more people experiencing stress. And the way that we think about stress these days is that it's really collapsed into three categories. So we have positive stress, which is really mild and maybe moderate in intensity, doesn't happen very often, and it can build resilience for the person experiencing it. Tolerable stress is a little bit more moderate to severe, happens a little bit more frequently. And although it can build resilience, you don't really see a positive sustained change there. And then toxic stress is where it is frequent or sustained, it's severe, and it results in negative changes to physical health, to mental health, to social functioning, and to academic performance. So just to define toxic stress really clearly, it's frequent, strong, and prolonged stress that happens early in life, although not really confined to an early period. And what ends up happening is that exposure to toxic stress really lowers the threshold for future stress responses and promotes a high degree of stress reactivity. So what that means is that people who are exposed to toxic stress become more primed to see stress in the environment and less able to deal with that stress. So that's a greater sensitivity to stress-inducing cues in the environment. So very clearly, I think we are living in a period where a lot of people are experiencing toxic stress levels due to COVID-19. So let's talk briefly about what kind of an effect exposure to COVID-19 has on mental health. And obviously at this point, the full extent of the impact is not currently known. And we may not know the extent of that impact for several years to come. What we do know, and this is based on concurrent data collection, so data collection that's happening now, and also based on previous pandemics. So that shouldn't say SARA, that should say SARS. So in previous pandemics, what we've seen is an increase in self-reported negative impact on mental health. So that's generally, I feel like this pandemic is having a bad effect on my mental health. We've very clearly seen an increase in symptoms of anxiety and depression. And that is especially the case in people who have a pre-existing anxiety or depressive disorder. We've seen a notable increase in substance use, and there's been some data released that showed that in March and April of this year, alcohol sales had skyrocketed from a comparable period in 2019. We've seen an increased and significantly increased risk or fear response to exposure to the contagion. Largely that's been with certain health professionals. Of course, the concern is that transitioning back into school where students will be distanced and people will be wearing masks and other PPE and lots of cleaning will be happening, that we really need to be very conscious of the effect that that is going to have or potentially could have on the students' fear of exposure to the contagion. And as I said, what we've seen in past pandemics, which with SARS, for example, we saw an increase in self-harm and suicide rates. I've seen some preliminary data indicating that self-harm rates have increased over the last couple of months. And again, that's probably more prevalent in a population that has a pre-existing mental health disorder or concern. So something we need to be very conscious of there. I put this quote in because I think it's really, really important to keep this in mind. That social isolation, anxiety, fear of contagion, uncertainty, chronic stress, and economic difficulties may lead to the development or exacerbation of depressive, anxiety, substance use, or other psychiatric disorders in vulnerable populations, as I said, including those with pre-existing disorders and people who reside in high COVID-19 prevalence areas. We're getting daily reports about whether our counties that we reside in are in the red or moving into the purple or in the orange, and what the prevalence rates are. And I think that we need to be very conscious that our students, especially the older ones, will be aware about some of those prevalence rates and will have heard some of that discussion in the background. And so we need to be really conscious that for many more of our students, they may be experiencing symptoms of anxiety, depression, again, fear of contagion exposure, and be aware that we may have an increased need to provide support services to those students. Some of the risk factors for poor mental health associated with pandemics include economic stress, and I think that many of our families will be in a position due to unemployment associated with COVID-19, social isolation. For again, many of our families, not just the students, but for many of our families, they've had a protracted period now of being socially isolated. And I will talk about that in just a couple of minutes. Decreased access to community and religious support, barriers to mental health treatment. So for our students and our family members with pre-existing conditions, and I would also say, for some of our staff members possibly with pre-existing conditions, it's going to be challenging because it's we're in a period where we're less able to access support services relative to where we had been prior to all of this. Outcomes of national anxiety, and I think this is something that I will address in the safe practices in terms of regulating and monitoring our consumption of media and social media, because the more, and we've seen this with prior pandemics as well, that the more that you watch the news and the more that you read reports on social media, the higher the incidence of anxiety and depressive symptoms. So it's something that we really need to be very careful about. In her very wonderful and informative and comprehensive webinar, Dr. Carly Wilbur talked about the ABCs of COVID safety, and I'd like to sort of transition into how to deal with and how to address the mental health effects that we're seeing associated with that. So always wear a mask, be aware of illness symptoms, clean your hands and your space, and the D, distance physically but not socially. And I think that this is really, really important. And I know there's been a push to move away from the phraseology of social distance, because we're not talking about socially staying apart, we're talking about physically staying apart. And there's a reason for that, because social distancing, so that is not connecting with people in the way that we previously would have, or in terms of the frequency and the duration. But social distancing really can contribute to frustration, boredom, low mood, and can potentially impact on people's depressive symptoms. So although we need to make sure that people are staying apart, I think it's really important that we're very clear about social distancing guidelines. I know that our state government has done a pretty good job of explaining why people need to stay at least 6 feet apart, and the importance of that. But I think we need to be very clear with students as well, because when we're not clear, when those guidelines are not clearly stated, we see an increase in anxiety and fear of contagion associated with less clear guidelines. And again, I think we need to be very, very conscious and very attuned to the impact that all of this is having on students with pre-existing conditions. Okay, so the kind of natural progression from social distancing, and we went through a period of stay in place, and I know that there's discussion about whether or not we are going to get back to a situation of stay at home or quarantine. And I think just a couple of comments on the effects of quarantine are really important as a way to address issues of social distancing. So most of the scientific reviewed studies reported negative psychological effects of quarantine, including confusion, anger, and an increase in post-traumatic stress symptoms. And again, keep in mind that this period can really be experienced as traumatic for many, many, many people. And among the key and most detrimental, in terms of mental health, the most detrimental stressors included a longer quarantine duration, fears of contagion or infection, frustration, boredom, inadequate supplies, inadequate information, financial loss, and stigma associated with getting the illness or catching the virus. So the more that we can do to really be clear, and that can be very, very hard, because there certainly be certain situations and factors that we cannot be really clear about. But the clearer that we can be with students and with families, the greater chance we have to mediate the effects that all of this has on mental health. So clearly one of the ways that we can deal with this quarantine and try to help students and their families to get through it in as healthy a way as possible is to work towards developing resilience. So just as a way to be clear about what we're talking about, we're really talking about a process of adapting well in the face of adversity, trauma, tragedy, and threats or significant sources of stress. So very clearly, this is a situation that requires resilience and requires those skills and those capacities. And although they are definitely multifaceted and comprehensive, there are some things that we can do and some strategies that we can put in place to help our students to build resiliency skills, and also to kind of come through this period of time as healthy and as unaffected from a mental health perspective, as unaffected as possible. So among the key strategies to build resilience, and these are things that we can do in our schools quite easily, are to prioritize relationships. So that's connecting with people and really managing those social relationships and not neglecting those social relationships. And so again, very importantly, we want to physically distance, not socially distance. Taking care of your body, this is something that we'll talk about in our safe practices, because this isn't just an issue for students, obviously, this is an issue for everybody. But practicing self-care strategies like good nutrition, ample sleep, hydration, regular exercise, these are very, very strong factors that will help to mediate and to dampen down the effect that exposure to this pandemic has. Practicing mindfulness, such as mindful journaling or yoga or meditation, or even a breathing practice like square breathing, for example, can be something that's pretty easy to do in the classroom even, and is very effective in terms of dealing with symptoms of anxiety and symptoms of depression. So we have in our Safe Schools programs and our teacher programs a comprehensive training around mindfulness practice and how to do it, what it involves, and all those types of support services around that. Something that I think that we can help our students to do is to keep things in perspective. Although this can be difficult, I understand that, but I think that we need to be able to help those students to identify areas of irrational thinking, such as catastrophization, and to be able to help them to exert some self-control and control over their environment. So we can't change every practice, but we can change our own practices. I think the thing that is something certainly that I will start from day one with our students is to accept change, to be flexible, to understand that change is part of our lives. It doesn't necessarily mean it's something bad, but that we have to adjust and we have to adapt to the circumstances. And so certain things that we may want to have on our list of things to accomplish this year, we may not be able to do that any longer, but that doesn't mean that our whole year has to be put to the side. We just have to adjust our expectations and adjust our approach. And then maintaining a hopeful outlook. So encouraging an optimistic outlook will definitely help as a strategy to improve mental health. And that might even be something to start our students' day with. So even just having them reflect at the start of the day on a couple of positive things that happened last night, or at the end of the day on a couple of positive things that happened during the day. So really, as an exercise and as a practice, working to identify those positive things that happen in your life and to really focus on those as a way to maintain a hopeful and positive outlook. So how can we promote healthy social and emotional learning in the class and with our students? So let's look at these individually. The first area, again, of self-awareness, where we're recognizing thoughts and emotions and understanding how those emotions and influence your thoughts and subsequently influence your behaviors. So when we work with students about regulating emotions, we can kind of take a DBT approach and help them to notice how they feel, to put a name to that emotion, to accept the emotion, so to understand that emotions are normal, to try to identify where the emotion came from, what were the antecedent events, to investigate that emotion. So how intense is it? How strong do I feel like this? And to allow the emotion to occur and allow yourself to release that emotion. So not holding on to emotions, recognizing them as a normal part of the human experience and trying to detach yourself from the connection to it, because it's that connection that really can kind of get us on a bit of a treadmill of negative thoughts and negative behaviors. So one way that you can help the students to really kind of detach and take a break is through deep breathing. And I'm going to just show you, this is the mindfulness breathing or square breathing or box breathing. It's called different things. And it's a good strategy and a good way to help students to regulate emotions, to manage emotions, and also to regulate, manage symptoms of anxiety as well. So in this mindfulness practice, you would just have the student inhale for a count of 4, hold their breath for a count of 4, exhale for a count of 4, and rest for a count of 4. And then just repeat that. And what we've seen, some recent research evidence has shown that a week of doing this for about 10 minutes a day can really help to reduce symptoms of paranoia in the adolescent and young adult age group. And it can really be a positive practice in terms of managing and regulating emotion as well. So the next area of self-management, we're really talking about managing stress here and controlling your impulses and controlling symptoms of anxiety. So in terms of stress management, practices that you can encourage your students to engage in are focusing on their strengths, doing things or focusing on things that make them happy, engaging in physical activity, taking tech breaks, or controlling social media use. Again, this is incredibly important, not just as a practice for the students, but also as a practice for staff. Talking to somebody, so making sure that the students know who is available to talk to. We, in our Safe Buddies program, so K to 5-year-old, grade 5, students, get them to identify who a safe adult is. So who is somebody that they can approach and that they can talk to when they're feeling unsafe or when they're not feeling good from a mental health perspective. So being able to get the students to identify who that person is that they can approach, and making sure that everybody in your school knows that at some point, as we return to school, that at some point our students may be approaching us because they're having some difficulty, so everybody can facilitate them getting the help that they need. And in getting good sleep, cannot stress the importance of sleep hygiene. And again, this isn't just for a student population, but also for all of our families, for all of our school staff, and of course for all of our PSI staff, that sleep hygiene is a incredibly important factor in promoting positive mental health and reducing negative effects of stress and anxiety. Some ways that you can help the students to manage anxious thoughts are getting them to write down something that they might be worrying about. With our high school kids, we will often do this. So at the start of a session, getting them to write down something on a piece of paper that might be upsetting them or stressing them out, and then folding the paper, and at the end, putting the paper in the bin. And it's a practice that can be effective in terms of helping them to detach from the connection to that stressor. And then one approach from a cognitive restructuring perspective is getting the students to answer some of the following questions. Is my thought based on a feeling or an actual fact? So has this happened, or is it just a fear that it might happen? Is it possible for my thought to come true? If it does come true, what's the worst thing that could happen? So this can be a difficult conversation, especially if it's COVID related, because obviously we know what the worst thing that can happen is. And I think that if you have a situation such as that, where a student is really worried about catching the virus, I think it's important to engage school staff, and I think it's important to engage their family and caregivers in that discussion. But being able to talk to them about the likely outcomes and the strategies to be able to keep yourself and your family safe can be a helpful approach. Will it still matter to me tomorrow or in the future? And what can I do to handle the situation in a positive way? So again, these are strategies that help to detach from the emotion associated with the situation and to take a more analytical perspective on building strategies to help to deal with it. Now, if a student is experiencing a little bit more acute anxiety, you might be able to sit with them and have them name 5 things that they can see, 4 things that they can feel, 3 things that they can hear, 2 things that they can smell, and 1 thing that they can taste, as a way to divert their focus on the anxiety-inducing situation, and really to kind of just calm down a little bit before you continue with whatever counseling or support services that you're providing. So the next 3 areas in our social emotional learning model of responsible decision making, relationship skills, and social awareness, because of the social component to those, I think it's important to kind of think about some strategies that might work in the classroom or in the school more broadly. So these are coming from the trauma-informed care area as an approach to really help students to be successful in the classroom. So providing structure and consistency is really, really important so that the students know what to expect. And while it seems like so much of our experience out in the community is peppered with uncertainty, the more that we can provide some consistency and stability for the students in the classroom, I think the better off they're going to be. Even though this is going to be an unusual transition back into school, and certainly unlike anything that probably any of us has ever experienced before, we still need to have concrete and clear limits on unacceptable behaviors. So being conscious that we may have an increase in the number of students who are experiencing symptoms of anxiety, but we need to be able to be consistent in terms of how we deal with the behavioral response to that. So we're talking about consequences, not punishment. We're providing students with opportunities and choices to help them to remain in control. I think it's really important for all staff to maintain their role. So if your role is as a teacher, then it's important that you maintain that role and pull in mental health and counseling services when necessary. Building relationships with at-risk students is going to be very, very important for all of the reasons that we talked about earlier on, where people with pre-existing mental health conditions are at significantly greater risk for developing symptoms of depression, anxiety, and our older students, substance use, absenteeism. One of the things that coming from the resiliency research area is that having a good, solid, supportive relationship with at least one adult can be a game changer for an at-risk student. Again, I think it's really important that our PSI, mental health, and health services staff are an integral part of the school day and providing support services to students. So at an appropriate opportunity, I think we need to pull in our school psychologists, our school counselors, and to be able to proactively address any emerging behavioral or emotional or mental health disorders or challenges with our students. And then the last point here is modeling emotional regulation. And there's a couple of things that I would like to comment on here. One is that especially for our younger students, it's going to be very, very important that they see us as school staff and adults dealing with this pandemic in a positive manner. They're going to take their cues from how we respond. So when a student has an outburst and a adult becomes emotionally dysregulated, it just makes that situation worse. Typically, the student's behavior escalates. And so we don't want that to happen for obvious reasons. What we want to happen is that the adult in the room maintains their emotional regulation. They maintain their emotional neutrality. And in doing that, it will help the situation to not escalate any further. So it's really important to keep in mind that an emotionally dysregulated student needs an emotionally regulated adult. And that's a big ask, I understand. This is a difficult time for many people in our communities. And so for that reason, I think it's really important to acknowledge that an emotionally dysregulated adult also needs an emotionally regulated adult. That being exposed to the risks associated with COVID is stressful. It's stressful for everybody. I think we should not be under the impression that that we're not also affected by that stress. And so we really need to be able to provide support for each other as adults in the school, whether we're teachers or counselors or school psychologists or nurses. We need to be able to manage our own stress and manage our own mental health in the most positive way that we can. And so for that reason, I want to talk to you about practicing safe or safe practices. And I've broken these down into 4 areas, obviously. The S stands for self-care strategies. You know, similar to the being in an airplane, and when the face masks drop down, you have to put yours on before you help anybody put theirs on. If we're not taking care of ourselves, our ability to take care of other people and to provide support for other people is really limited. So having good nutrition, having consistent and regular exercise, having good sleep hygiene are all really important factors. I can make this available on our internet for everybody, but this is just a self-care plan that I put together to help people to map out what are the practices that I'm going to engage in to help my mind. So those might be meditative practices, those might be saying 3 things that were positive or 3 things you're grateful for at the end of the day. What are the practices I'm going to engage in to help my body? So that would be regular exercise, good sleep hygiene, good nutrition, drinking lots of water, minimizing alcohol use. What are practices to help my spirit? That might be going for a walk in the woods. It might be going to your church or synagogue or place of worship. Who are the supportive people in my life that I can lean on when I need to? And it's really important to have people like that. Those can be people in your family, they can be friends, they can be other PSI staff, but people that you can connect with and debrief with at the end of a difficult day, be important to have. And then what are your goals? And I think, again, I mentioned this earlier, but recognizing that this is an unusual time and that our goals are going to be different this year than, for example, last year, is really important and to be able to articulate those goals. So what are the things that we want to achieve in the next month, in the next 6 months, in the next 12 months, will be important to list out there. The A in our safe practice is for awareness of the effects of media and misinformation. Both of those things, and when I say media, I include social media, but both of those things can really significantly increase symptoms of anxiety. And so we have been advocating at PSI since the pandemic really started back in March, when our schools closed, to really regulate and monitor how much social media use you're engaging in. So really no more than 10 minutes in the morning, 10 minutes in the evening. The more you can manage and monitor and regulate it, the better, to be honest, because we do see an increase in symptoms of anxiety associated with social media use. The F stands for following all the recommendations and guidelines regarding health and safety practices. And as I mentioned earlier, Dr. Wilbur gave a wonderful webinar about all of the safe practices that we should be and need to engage in, such as wearing a mask, washing your hands, etc. And then the E stands for engaging with friends and with family. And I would also include with other PSI staff. We want to distance physically, but we definitely do not want to distance socially. The state of Ohio has a lot of additional resources. So you could call the COVID care line, which is available 24 hours a day, 7 days a week, and some additional support services. The Ohio Crisis Text Line, you can text for HOPE to 741-741. The Ohio Mental Health and Addiction Services Helpline. Substance use and mental health treatment can be found at findtreatment.gov, and the Disaster Distress Helpline at 1-800-985-5990. And these are all listed on the Ohio State COVID resource page. And of course, if you have any questions or any concerns or are in need of support, you can always contact us at PSI. So thank you very much. And if you have any additional questions, you can reach me at Julian Dooley at psisolutions.org. Thank you and take care.